Hello everyone, this is Dr. Wes Coons and I want to spend some time going over disc injuries. A lot of you out there might be suffering from a pretty severe disc injury like a herniation, a bulge, arthrosis, or degeneration. I know about this because, hey, that problem's happened to me in the past, and I want to kind of break this down in a very simple way so you can understand what one of the options is and what one of the better options is out there to help with your problem. Not only to get rid of the pain, but to help hopefully fix it a little bit more so that you can live a more happy, healthy, pain-free life, do what you want to do, and not have to pay a huge price for it. Not have to live a secondary life or have to go in for surgery every 5 years and have pieces cut off. So I'm going to talk a little bit about disc injury and decompression therapy. So let's start with basic anatomy. The first thing is we're going to talk about the disc. The outer layer of the disc, called the annulus, is kind of like a steel-belted radial. The inner layer is a jelly-filled center, kind of like a jelly donut, called the nucleus. Now the nucleus is 86% water on the inside. Now, the misunderstanding is how this tear. Most of the time, either through a fall or a twist or a lift or some type of a sprain, it starts to tear a disc. It's called annular tearing. And the annulus is this hard outer layer. The tearing typically comes from the inside out. A lot of people think it comes from the the outside in, but it's really the inside out. And that tear then allows this nucleus to displace, and it starts to form a bulge on the outside of that disc. It misshapes the disc. And if the nerves and the spinal nerve roots are right in that vicinity, it may start causing some pressure. It may start causing some irritation to that nerve root. And if it starts to tear even further, that nucleus can prolapse or tear out through the annular fibers, and a very inflammatory nucleus can get onto the nerve root and cause a lot of trouble. Now, when it's severe enough, typically what the medical community does is say, here, take some pain relievers until it gets bad enough, and then we'll go in and we'll cut that area out. And that could be a discectomy, where they just try and cut part of this disc off and hope that the scar tissue doesn't grow back. Or it could be a laminectomy, where they take the outer part of the vertebra and they try and cut a section out of the vertebra and hope that scar tissue, again, doesn't fill in that area and cause problems. And or a disc removal, where they try and fuse the whole disc, and well, you know how that goes. Now that's no longer there. Hopefully scar tissue, again, doesn't cause problems in the future. But with the fusion, you also have the spot above and below the fusion, which might actually start taking on more force. Now, what I'd like to do is determine whether or not you can treat this with traction. Now, traction is when you have two vertebrae that are very close to one another, and they're causing a problem with it bulging out. And then what you want to do is you want to pull two different directions. And as you do so, you're trying to pull into this area oxygen, water, and nutrients. And as you do that, we can have what's called type 4 collagen bonds can start to form and hopefully start healing that disc from the inside out. Without that action of pulling moisture and oxygen and nutrients into the disc, it just simply won't heal. So what we're trying to do is not only rehydrate the center mass and allow it to pump, but we're trying to allow the cartilage bonds to heal and form in that area as well. So over time, then what we can do is we can start to then remobilize the segments, stretch the supporting muscle groups, and strengthen it. So I just tell you this because I know that some people out there are really suffering from this. There is hope. Let me tell you that this is a fantastic approach. We've used it on dozens and dozens and dozens of people, if not hundreds. And do your due diligence. Look up spinal decompression on the internet and or call my office, and we'll see what we can do. Thanks a lot. This is Dr. Coons signing out.